Hello everyone, let's try to solve this question together. So here we have an infant and she's placed on a ventilator for respiratory distress. The ventilator settings and the chest x-ray are shown below. She weighs 4 kg. The blood gas shows a pH of 7.4, PCO2 of 42, PO2 of 56 and base deficit of -2. The best action is pause the slide, zoom the picture. What do you guys think is the correct answer? Okay, the correct answer here is consult surgery. And the reason is, if you guys can follow the x-ray and you see that there is a big diaphragmatic hernia on the left side. So, and the gas now is okay. So increasing tidal volume and increasing rate will not really help. Obtaining an echo does not make sense at this point because gas looks okay, although the heart gives a shadow which looks little tilted to the left, but because this is a slight rotation, plus this could be the thymus shadow here. So again, A, B, C are not the correct actions here. Consulting surgery is very important. Although the baby is very stable now, but as you guys remember that this diaphragmatic hernia, the babies can get into PPHN or persistent pulmonary hypertension, and then it will be very difficult to oxygenate. So getting a surgical opinion is of prime importance at this time. So I hope you guys have learned something together today. Please do like and subscribe our channel, and you guys have a wonderful day. Bye.